fibrinogen, WBC count, von Willebrand factor, and the plasma lipoprotein, which will cause ischemia and angina. So again, what we need to understand in this is, I'm not going in detail. Basically, when there is an antigen getting into your body, because of the addition molecules, it get binded to your blood vessel, and initially the defense mechanism, yes, phagocytosis, chemotaxis can happen, but later the lipid LDL, what happened, low density lipoprotein, will get imbibed by the macrophages and it forms foam cells. So this foam cell eventually stimulate the smooth cell proliferation, collagen proliferation, which causes plaque formation, decreases the blood flow and rupture the plaque, and the circulation get exposed to the entire arterial collagen and the tissue factor, and it activates the platelet and the coagulation pathway, which in turn leads to thrombosis and finally myocardial infarction through embolus. So again, we need to always remember, for the chronic periodontitis and the heart disease, hyperresponsive monocyte or macrophage phenotype will be a common neutrophil which will be for both the diseases. So both the diseases has lots of similarities and the permutation and combination. So what you need to do for the hypertension, please monitor BP in two readings when the patient comes to your clinic, because dental treatment is a apprehensive one for the patient. So when they come, the BP will be really high. So give 10 minutes gap and see the reading another time. Avoid early morning or morning appointments, because we usually think when we get up in the morning, and I don't know how many of you have experienced, the entire day we know what all the challenges we are going to face, but when we get out from the bed, that is when we remember all the tensions that is there for the entire day. It looks in a very zoomed manner, that is there, this challenge is there, I have to go and stand here, they're not giving appointment, this is not happening, kids exam or the husband's fight or whatever it is, it comes to your mind immediately the moment you get up, because that is a time your BP level also will be like really higher. So, 10 minutes, at least during your brushing itself, you'll be kind of little okay, but the time when you get up will be really more. So try and avoid the morning appointments and limit the surgical site. And LA without epinephrine is a very, very common thing that you need to give for your patients without epinephrine. So the next thing that you have to have in your crash cart would be LA without adrenaline. Please do buy plain LA and keep it in your clinic. And even vasopressor should be applied locally to control bleeding. Profound LA has to be given. For hypertensive patients, the conscious sedation is preferred. Avoid intraligamentary injection. Beware of postural hypertension for the hypertension patient. For the ischemic heart disease again, see, rather than getting into the science, basically the oxygen demand will be more for these patients. What I want you to understand is, basically when the patient has angina in the dental chair, so we will be really, really worried. We will be like, don't know what exactly is happening with the patient. It's just a stress or anxiety or whatever it is. We pray that it should be just an anxiety, but it could be an ischemia as well. So the magic drug that you should always have it in your clinic would be nitroglycerin. 0.3 to 0.6 mg nitroglycerin. Even for apprehensive patient, you can place it under the tongue and then start with the dental procedure after some time. So always remember, if in case patient is having a chest discomfort or a tightness or anything, again nasal cannula, oxygen, and what you need to do is, you need to give nitroglycerin and wait for 3 minutes. Okay? In the second, after 3 minutes, again if the patient doesn't get relief, give the second dose of nitroglycerin. Again, you can wait for 3 minutes. And in the third after the third time, also you're giving nitroglycerin because the symptom is not relieved. It is not just ischemia, it's myocardial infarction. So maximum, the theory says we can give 3 doses of nitroglycerin, but I would say first and second. Second itself, if the patient didn't feel even better, little bit also, please do get medical help. Again, this nitroglycerin is one disadvantage of nitroglycerin. It has a very, very less shelf life. So if we say we need to buy and keep it in the crash cart, it doesn't mean we can use it throughout or 1 year later or 2 years later. It has a very, very, very small shelf life, so you need to constantly keep changing it. So again, the increased shelf life will be with the nitroglycerin spray spray, but again, we don't know, accuracy is difficult in that. How much are you spraying? We can't have the control over that. Again, usually nowadays, because heart and ale, we get tensed, and what we do is, we give antibiotic for any cardiac patient who walk into our clinic. For a CABG, coronary artery bypass graft patients, we don't have to give any antibiotics. Antibiotics are required, especially prophylactic for cardiac patients, only for the valvular heart disease, infective endocarditis. Otherwise, antibiotics are not required. Again, congestive cardiac failure, for these patients, ventricular arrhythmia risk are there. Orthopnea is very, very common. So please don't slant your chair. Don't recline your chair. Treat them in the upright procedure. And another thing you need to remember in congestive cardiac failure patients is, all the drugs which is there in the congestive cardiac failure patients has an impact with the dental treatment. Any drug, digitoxin or whichever drug you take it, whatever is administered for the heart failure has a side effect on the dental treatment. So please do get and consult an opinion. Again, pacemakers and the cardioverter defibrillators, what I want to make you understand is, unipolar, bipolar is there. Bipolar pacemaker, you don't have to worry, you can just do. Unipolar, it affects the electromagnetic field, so you can't do ultrasonic scaling. That is something you need to see when the patient comes with the pacemaker. And with the defibrillators, what you need to do is, the defibrillator gets off and again activated. This is a form of defibrillators we're using right now. So what happens is, when it stops and gets activated, the patient will have a jerk. So you may cut the oral tissue when you're doing a procedure. So defibrillator, you need to be very, very careful about the jerks that the patient may have. Again, infective endocarditis, I think I've already told about this. This is something where the American Heart Association is suggesting for prophylactic antibiotics. This is something. And in aggressive periodontitis patients, usually if they're having infective endocarditis, please give them tetracycline 250 mg 4 times daily for 14 days. Followed, after which only you should start with the dental procedures. So this is for the infective endocarditis. They don't know the terminology infective endocarditis when the patient comes to the clinic. They say it is valve disease. So for those patients, you need to follow this regimen. So again, stroke, there's nothing much we can do, because with stroke it alters coagulation. So oral hygiene instruments has to be little altered. Chlorhexidine mouthwash has to be given. No procedure for the next 6 months. And these are the researchers. Yeah, so I don't want to go in detail about these things. These are some genetic disorders. What you need to remember in this is, usually with the patient suggest of celiac Higashi or lazy leukocyte, aggressive periodontitis is common. So these are the other syndromes that is there, Down syndrome, Papillon-Lefebvre syndrome, all these syndromes are there. So with these syndromes, there's nothing much we can alter and do. Already lots of dental manifestations will be there in these patients. Again, with the renal diseases, there are different forms of kidney diseases available. Yeah, what you need to remember is, end-stage kidney disease patient will always have hypertension. So if the patient says, doesn't know about it, if the patient has hypertension, please do have it in your mind about the end-stage renal disease. What you need to do is, you can operate on this patient only if your blood urea is lesser than 60 mg per dl, greater than 60 mg per dl. No dental procedures can be done if your serum creatinine is lesser than 1.5 ml per dl. And nephrotoxic and kidney synthesizing drugs, it is better to be avoided for the kidney patients. Especially in dental, what are the kidney synthesizing drug or nephrotoxic drug that we are giving? Tetracycline. So for kidney patients, try and avoid tetracycline for this patient. So again, in GA, what are all the safe drugs that you can use for the kidney patients, renal disease patients? GA, acetaminophen is safe. For the sedation, diazepam is safe, and for LA, lidocaine is safe. And hemodialysis, yeah, more common. See, usually renal patients, all the patients invariably will have dialysis. So what we need to remember is, during dialysis, we may have a external artery venous shunt or arteriovenous fistula. So for dialysis patient, always remember, you're not supposed to give pressure in the hand. So please don't take BP with the tight cuff for the dialysis patient. So again, you have to be aware about the increased hemorrhage. Again, be careful about hepatitis B and C. Antibiotic prophylaxis has to be given to avoid the endarteritis or fistula or shunt. Again, be aware of heparin therapy, which I have already explained. Transplant patient, treat them before the transplant, and please don't trouble the patient with major surgeries like periodontal surgeries. Let them go for extraction. So lung, again, various diseases are there. You need to do the dental procedure without, depressing the respiratory functions. Consult regarding the drugs. Patient will be mostly under steroids, chemo agents and antibiotics. So consult regarding the drugs. Avoid mandibular block. Position the patient where they have a maximum ventilatory efficiency. An inhaler should be there in the countertop. When the patient comes for the treatment, tell them to bring the inhaler, and it should be in the accessible area for the patient. And these patients have active respiratory or bacterial respiratory disease are more common. So do not treat unless emergency for these patients. Otherwise, you will become a lung disease patient soon. So again, in this, what I wanted to remind you is, patient who says the patient is having cancer or osteoporosis, you need to remember that the patient are more prone for bronch. There's nothing but in these two conditions, the patient will be taking bisphosphonates. So when the patient has bisphosphonates regularly in cancer or more than 3 years it is administered for osteoporosis, the patient may have bisphosphonates related osteonecrosis of jaw. So you need to be, there is something called C-terminal telopeptide fragment, which is available in any of the Gemini or Aarti or scans, any scan center. You need to ask them to take this before you treat cancer patient and osteoporosis patient, because that should be between 300 to 600 pg per ml if you have to treat it without any risk. So again, I don't want to repeat the slide. You remember, when the patient is under corticosteroids, maybe for hypertension, osteoporosis or peptic ulcer disease or anything, the drugs like acetyl salicylic acid and NSAID can get interacted. So you are not supposed to give acetyl salicylic acid and NSAIDs for the patient who are taking corticosteroids. And even if they are applying the topical corticosteroids, remember, supplements are required. So it will have an effect on the HPA axis, and even for those patients, you need to have supplements. So again, for the chemotherapy patients, they are more prone for infections, so conservative and palliative treatment should be done. And for the chemotherapy patients, chlorhexidine is mandatory, extraction is advisable, dental treatment should be done before chemotherapy, and these are the reference values. WBC, the BC should be greater than 2000 per cubic millimeter, and absolute granulocyte count should be 1000 to 1500 cubic millimeter. Please treat the patient in the recovery phase, not in the active phase for the chemotherapy. You can ask the consultant, they will say the time period for you, the recovery period. In that time, you can treat the patient. So these are the usual symptoms that we see with the radiation therapy, like xerostomia, TMJ problem, taste difference or whatever it is. See, this, what I would say is, please do make a note of whatever I have told. If the patient is saying they are going through a radiation therapy, you have to take info about the amount of radiation, extent of radiation, number of radiation. So for example, if the patient is under squamous cell carcinoma and they are advised to take 5000 to 7000 centigrade radiation, it will be given in a fraction method of 150 to 200 centigrade over 6 to 8 weeks. That's how it will be given. So you need to remember how many sittings, what is the radiation proportion, what is the amount of radiation, everything. So please avoid extraction that intervenes with the healing. So for extraction, no tears should be there for this patient, no bony spicules. Closing primary closure has to be given. OHI, fluoride application to avoid the caries has to be given. So for the ulcer patients, viscous lidocaine can be given. For the xerostomia patient, salivary substitutes can be given. Again, for the prosthetic replacement, knee replacement patients, currently the association has suggested antibiotic prophylaxis is mandatory. And to end with, Yeah, hepatitis is something very, very common, something which is happening. So, dental treatment only on emergency, past treatment. See, for the recovered hepatitis A and E patients, you can do a routine procedure. We don't have to worry about it. For B and D patient, you can't touch the patient without the physician consultation. So, basically what we need to do is, if the antigen is negative, yeah, repeat the test, confirm it again and no problem. If it is antigen is positive, measure the degree of infection. Again, if the antibody is positive, routine treatment. Antigen is negative, routine treatment. So, HCV, consult the physician. Again, for hepatitis, BT and platelet and the bleeding time has to be seen. Full barrier technique, 2 masks, 2 gloves, everything, full barrier technique, proper waste disposal, try and use all disposable instruments, aseptic technique, decreased aerosol, chlorhexidine mandatory. Treat them with care and little bit of patience, HIV patients. What they need is just the love and care, not our treatment. Don't trouble them with much of treatment because we can't make much money with them because we don't know how many days are they going to be there in this world. But treat them with lots of affection, care and compassion for these patients. And finally, TB, it's a very, very common one that we are facing. Please ask for the sputum culture for Mycobacterium tuberculosis and get a medical clearance before routine procedure. Remember, the TB treatment is for 18 months and the review has to be done every 12 months. So if the patient is saying, I'm under treatment, you're not supposed to treat the patient. They have to finish the 18 months for the treatment. Yeah, this slide, yeah, these are the common organism from the dental which is impacting the diabetes mellitus, pregnancy and the CVD. These are the 3 conditions where the microbacterium is shared very commonly. I would like to thank my college, my principal, Dr. B. Sundaram, and the president and Rajshekhar sir for giving me this opportunity, and every sweet member of IDA Tiruvallur for making this happen. I would like to thank my department staffs, my family, my both kids who has come here and trying to stay patiently at least till I finish the talk, and the universe for giving this opportunity, and always my husband for being a pillar of support for me.